We're joined once again by Brian Gragnolati, President and CEO of Atlantic Health System. Good to see you, Brian.
Great to see you, Steve.
So we're taping on the 16th of February, be seen later. Put things in perspective. If we're talking about vaccine distribution, vaccine availability, right now, as a major player in that with Atlantic Health, what are the biggest challenges you believe we face, A, and B, I'm going to load up this question, where do we need to be 3 months from now?
So the fact that we have these two vaccines right now, and they came to us as quickly as they did, and they are highly effective, is a miracle. So that's the good news. The fact that here at Atlantic, we've almost administered 100,000 doses of that vaccine into our team members, our frontline workers, as well as our community members.
And that's as of now. It'll grow, obviously.
Yeah, you bet. It's also pretty amazing. But the real trouble right now we're having is getting that vaccine. We're doing about 3,000 vaccinations a day, and we can be doing 10,000. We got 11 sites set up, and we're ready to rock and roll. We just need the vaccine.
You could do 10,000?
We could do 10,000 vaccinations a day.
So if the Biden administration is able to do what it says it wants to do in terms of increasing the supply, with all of the confusion, all of the, oh, I can't get through on that website, this phone number, whatever, you're saying just the significant, dramatic increase in supply dramatically changes, doesn't fix all of the distribution problems, but dramatically changes it by itself.
Absolutely. It's all about supply, because we have safe and effective vaccines. We've got other vaccines that are coming online, which look like they're going to be easier to handle, have less cold storage requirements and things like that. And we've got, particularly here in New Jersey, we've got over 300 sites in New Jersey alone for vaccination. We can do, and we can get to the goal of having 70% of the population vaccinated by the summer if we have the vaccine.
Let me do this. And by the way, Atlantic Health, one of the many healthcare organizations, hospital systems that support what we do. Brian, let me follow up on this. As it relates to the role of hospitals and hospital systems, and by the way, let everyone know what hospitals are in your system.
So we've got Morristown, Overlook, Chilton, we've got Newton, Hackettstown, and we've got a rehab center that we do in partnership with Kindred Healthcare.
So my question really is about the role of hospitals and healthcare systems. From your perspective, and you understand this nationally because you were the chair of the National Hospital Association, if you will, correct?
American Hospital Association.
Right, I apologize. So are you comfortable with, are you satisfied with the degree to which hospitals and hospital systems have been engaged and participating directly with the vaccine distribution?
Here in New Jersey, because remember, the Trump administration gave the responsibility to the states of administering the vaccine, arguably, in a way that was difficult for the states to be able to accept it. But they did that, and the governor put together a method of doing this. And the first group of hubs that were created were our hospitals and health systems, because of our ability to handle this type of medication because of the cold chain requirements, and the fact that we could reliably distribute this to large numbers of the first priority patients, which were healthcare workers. All of us in the state who work in hospitals and health systems take this as our community vow. I mean, this is what we do, and we are ready, willing, and able to serve the community in this way. And that's why here at Atlantic, we've really leaned into this. And I've said to our team, we will be in a position to do 10,000 vaccines a day. That's what we need to do, and that's what we mobilize to do.
You mentioned frontline healthcare workers. So there are some folks, it's anecdotal, but it's not just me. There are some friends, family members who said early on when the vaccine became available at an incredibly warp speed fashion. If physicians or nurses or other frontline workers are reluctant to take the vaccine, why would I? Now, that was earlier on. As we speak today on the 16th of February, to what degree is there resistance on the part of frontline healthcare workers, A, or B, hesitation, and there's a difference. Resistance, I'm not doing it. Hesitation is I'm waiting. Go ahead, Brian.
So as we speak today, 62% of our team members at Atlantic are vaccinated. And there was really no hesitation in that. The remaining folks really are a bit watching and waiting, that hesitation. Let me see what happens, because there's a lot of myths out there rather than facts out on the web, and people listen to that. But in addition, people want other people to go first also, and so we see that occurring. But every day, more and more of our team members are getting vaccinated as we are vaccinating community members. But remember, to do 100,000 vaccines, we've got 18,000 employees. So the bulk of the vaccinations that we've been doing are to community members.
I'm going to follow up with something. You said 62% of your employees. Is it higher for physicians and nurses as clinicians than it is for everyone else? Is there a difference?
Yes, it is. I think the closer you are to the science and understand the science, your questions are answered and you go ahead and do it without any hesitation. I think people want to have their questions answered about the vaccine. And so a lot of the work that we're doing now on the balance of our workforce are really spending the time to listen to those questions and answer those questions in a way that people have confidence in moving forward.
That is reassuring that those who are closest to the quote science, as you said, Brian, are more likely to
Absolutely.
have gotten it and will get it. Brian Gragnolati is President and CEO of Atlantic Health System. I want to thank you, Brian, for joining us. To you and your colleagues, particularly those who are on the front lines, the physicians, the nurses, the respiratory therapists, so many others. Thank you for what you do every day. Thank you, Brian.
Thank you, Steve. Take care.
You got it. I'm Steve Adubato. Thank you so much for watching. We'll see you next time.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Healthcare Foundation of New Jersey, Delta Dental of New Jersey, the Northward Center, NJM Insurance Group, the New Jersey Education Association, the Fidelco Group, Fedway Associates, Inc., Georgian Court University, and by the Adler Aphasia Center. Promotional support provided by NJ.com and by NJ Biz.
NJM Insurance Company has been serving New Jersey policyholders for more than 100 years. But just who are NJM's policyholders? They're the men and women who teach our children, the public sector employees who maintain our infrastructure, the workers who craft our manufactured goods, and New Jersey's next generation of leaders, the people who make our state a great place to call home. NJM, we've got New Jersey covered.